My name is Stephanie George.
My name is Emmanuel.
My name's Charlene,
And I had a stroke.
1 minute, I was there full of life, full of hope. I was actually looking forward to this new career, and all that just came to a full stop. So, apart from shock, I felt like I was in a hopeless situation.
When I got the call that Emmanuel's collapsed and they think it's a stroke, I fell. Just changed in every way in a split second. We had our third child 6 days before. So in the first few days of Emmanuel having his stroke, he was transferred from the London hospital to our local hospital.
My experience with healthcare professionals has been a mixed bag, really. I discovered that being black meant that I was put in a kind of box because being put on antidepressants just because I was a young black man, when in reality that was not what I needed. And my wife had to actually make the argument that it was not even discussed.
Emmanuel was told, you're being put on antidepressants because he's a young black male. I remember thinking, what? I said, you've just told him he's paralysed, he's going to feel a bit upset about what's gone on. It's a massive change, you don't know if it's going to affect him. That particular conversation is what I remember. They wanted to have it out of the room. And I remember saying, no, we need to have this with him there. And I think in that moment I realised that, okay, wow, this is going to be a challenge. And it just drove my anxiety up so high just because, what's next? What's going on?
Because I didn't have the usual symptoms of having a stroke. They did everything that they could in trying to find out what had happened and why it had happened. They were very kind of diligent in their testing, which led me to being there for like a week, even though I really wanted to go home. Everyone was kind of attentive. I felt like I could talk to people and they would understand.
I have had great relationships and great experiences with healthcare professionals, but I've also had some really terrible experiences with healthcare professionals. There are some healthcare professionals who are just, and I know this might be harsh, but they're just about their ego. They want to tell you what is wrong with you and you just have to accept it. I would love to say that that's few and far between, but it's actually quite a lot of professionals who, and this is just from my experience, who would tell you things about yourself, even though you know that's not the way it is. Healthcare professionals tend to forget that, people do remember how you make them feel. There's so many bad experiences, as I said, I've had over the years, and I don't forget how I felt. And the feeling always stays with a patient, and it does make all the difference. What I just want is for people to take me seriously when I come into hospital and for people to just work with me. I don't know everything, but also they don't know everything as well.
There's been a level of mistrust. I think systematically we feel a little bit oppressed when we have to go to a healthcare professional.
There is a big history of mistrust between the black community and the NHS. And I do think also there's an element of racism. There's a lot of systematic racism just in society already. You do get a lot of people saying the wrong things, knowing that they're not going to get in trouble for it. And the way I've been treated over the years by healthcare staff, sometimes that trust just isn't there. With black people and racism, sometimes it is hard to navigate a relationship with the healthcare professionals. I always go to the hospital at the last minute because I'm scared of how I'm going to be treated.
I had an experience where I was actually missing one of my medicines, and even when I told a member of staff that the medicine was absent from the hospital, they didn't take me seriously. I was dismissed when I shouldn't have. And it was a very important medication at the time. That does not help create trust in any way. Rather, it completely erodes it, and that's not helpful for anyone in the long run.
Talking to family and listening to them, involve them as much as you can in every aspect of their care, because they're the ones who's going to be taken on board, once that person comes home, and listening to them. How can we make it work for this family? Those conversations help, and they reassure you that my husband's in safe hands.
Health professionals working with Black people need to understand that there are cultural differences. You need to find a way to have conversations with people and do not just dismiss anyone or put them in a box. What each person is experiencing might actually be atypical to what you're used to. And most importantly, you need to listen to what they are saying. There's the need to listen.
I think sometimes they need to just give us or offer us a more holistic approach, try and understand their culture a little bit more.
I've had experiences with doctors who've just been like, what can we do to make this journey a little bit easier for you? It would just be great if everybody could follow that, because I've come into hospital because I'm feeling vulnerable, I'm not well, so I need to be looked after. I shouldn't be feeling fear. So just being, aware, bear those differences in mind, and just work with your patient, support your patient, be honest with your patient, because I do feel a lot of the time people aren't honest, and it could be that, oh, do you know what, we're so short-staffed right now, I'm going to come back to you, please, I haven't forgotten about you, please can you just bear with me? Even stuff like that. We know that the NHS is busy, we know that they're short-staffed, so just be honest with your patients. I think that is the best thing that a healthcare professional can do to support a Black person. It's going to take a long time, many years, before trust is built. In the long run, it's going to be beneficial for everybody. I do feel that if you keep working at it, I think that can be done.